Hello, good morning. Welcome to the second part of the webinars. We will start the second webinar. I will now introduce Bojana Knežević. She works on the University Hospital Center of Zagreb as part of the Department of Quality Improvement and Patient Safety. Bojana also lectures at the School of Medicine to postgraduate of occupational health students of University of Zagreb. Bojana is also the STSM coordinator and member of the core group of the Ernst Cost Action. So I will leave you the floor. Thank you so much for being present and for your collaboration.
Thank you so much. I would like to say hello to all participants and thank to organizers and thanks to Jose and Sofia to organize this event. I will talk today about resilience of healthcare workers after adverse events, about stress at work in healthcare, type of adverse events, patient safety culture, regulation and procedures, and I will show you a short example from University Hospital Center Zagreb, how we manage adverse events. Resilience is definition of resilience is that is one's capacity to cope with stress and stressors within work environment and the ability to promote personal well-being. Psychologists define resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats. This is powerful survival method. This is well known that occupational stress in healthcare is in a top 10 most stressful activities. Occupational stress is recognized in modern world as an important factor affecting health. The most common stresses in healthcare is heavy workloads, unpredictable situations, as adverse events, for example, engagement in an emotional situation, risk of dangers and hazards, and other challenges at work. The pandemic COVID-19 has exacerbated these challenges. This year is a International Year of Health Care Workers. WHO say this is year of everyone who work in healthcare. Occupational stress in healthcare many studies shows that healthcare workers have high rate of substance abuse, depression than other professions. Other outcomes are burnout, absenteeism, employee intent to leave, reduced patient satisfaction, and errors. Concept of medical harm has existed since antiquity, famously discussed by Hippocrates and passed on the word iatrogenesis. Today we talk about adverse events. Type of medical harm could be also near miss and errors. Adverse events is unintended harm to the patient caused by medical management rather than by the underlying disease or condition of the patient. Adverse events, a quarter of these events in Europe are associated, healthcare-associated infections. Other types include medical errors, surgical errors, diagnostic errors, medical device failures, or failure to act on test results. Near miss are all that in fact they could have adverse consequences, but they didn't. This is potential adverse events or close call. Very important is to report also near miss, because this event did not cause harm, and we could prevent next time and to do everything to avoid really adverse events. Errors is an act of commission or omission leading to an undesirable outcome, a significant potential for such an outcome. These errors are when healthcare workers did something wrong, or if they didn't something, so they have wrong diagnosis or found something missed, and they lose time for do right thing and care patient. After this events, medical healthcare workers has to report this and discuss about this, and together with other healthcare workers, they has to make measures for prevent these events. But these medical errors and unanticipated negative patient outcomes can damage their well-being, their workability, and their self-confidence. These affected individuals, referred as second victims, can experience various psychological and physical symptoms. They could feel that lost control in this situation. When you see at this model, job demanding control model, made by Rudolf Karasek, you can see that if you lose control in a high demands job, this is very high strain and could lead to psychological and physical illness. So it's very important after adverse events to increase our control. In organization, it's very important to choose at the beginning. It's very important that choose right worker at the right place, and it's clearly defined roles and responsibilities. Give workers opportunities to be active and to participate in decisions affecting their jobs. Improve communication and reduce uncertainty about career development, and provide opportunities for social interaction among workers. This good work atmosphere is very important, that employees feel safer at their workplaces. The most commonly implemented interventions in healthcare include team processes, multidisciplinary healthcare teams, and multi-component interventions. Also, it's very important that employees are focused to themselves, individual stress management, including training in coping strategies, progressive relaxation, biofeedback, cognitive behavioral techniques, time management, interpersonal skills. If we have high control in high demand situation, we are active in this situation, and it could be motivated for our work and for our duties. Adverse events are unexpected events. Adverse events is also a big stressor in healthcare, and it has impact on patient, healthcare provider, and institution as well as healthcare system in total. It's very important is to learn good coping strategies, to react in an appropriate way, to be adaptive, to be functional after adverse events. Many studies show that professionals can speak openly about issues and events in a safety culture. It's important that this culture is a no blame culture without punishment, a culture of dialogue. Managers promote safety and reporting of adverse events and made it as a reporting and learning system. HIV also published one document towards eliminating avoidable harm in healthcare. And here you can also find definition of patient safety. Patient safety is framework of organized activities that creates cultures, processes, procedures, behaviors, technologies, and environments in healthcare. And that consistently and sustainably lower risk, reduce the occurrence of avoidable harm, make errors less likely, and you reduce the impact of harm when it does occur. Reporting and learning system. First, adverse events has to be quickly documented, fully reviewed and investigated. And it sometimes leads to redesigning of process of care, products and procedures, and changes to the working practice. And for evaluating our measures, is important to find good indicators to be measurable and sustained reductions of risk for future patients. This circle Paolo showed, and it's very important to measuring harm, to understanding why this happened, identifying better solutions, expecting it, evaluating impact, and translating into safer care. Education about managing adverse events is very important to the continued medical education. And of course, if you have implemented safety culture and culture of dialogue, you can also organize education. Very important is to increase safety competencies of healthcare workers, working teams for patient safety, communicate effectively for patient safety, recognize, respond, and disclose adverse events, manage safety risk, optimize human and environmental factors. These all parts are very important and to be connected. Organizations with strong reporting culture are well placed to learn from errors. The reporting of errors are heavily dependent on the leadership and culture of an organization. It's very important that leadership and top management of hospital understand why is all this important. There is a correlation between organizational culture of healthcare facility and safety of patients being treated in that facilities. Organization culture means that every employee understand what is important, how things work, and that they feel that this is their way, how the things doing around here in their organization and organization culture. Still today are very important to say that very little attention has been devoted to healthcare workers involved in adverse events to help them cope with their responsibility. Very important is to report, to learning, to education, but sometimes we forget that some of healthcare workers need to receive psychological help. Some studies showed that healthcare workers recognize that they need psychological or other support options. This study showed the study of second victims' experience showed that the two most desirable support options: a respected peer to discuss the details of what happened. They need to discuss with their colleagues who know the process in detail, how could it happen and what to do. And discussion with manager or supervisor about this incident. I would like to show you an example in my hospital, how we manage adverse events. In the main cycle of quality, of course, it could be better, but I could show you how does it work now. We have law on quality in healthcare and ordinance for quality standards. According to this national regulation, we wrote guidelines of quality in healthcare in our institution. And we have for many processes about more than 2,000 standard operating procedures. And also we have standard operating procedures for managing adverse events, and we have form for reporting. Our employee could report adverse event to the application on our internal website by mail. If the adverse events is very serious, if it's sentinel events and the harm for patient is very serious, obligation is to discuss about the circumstances during expert meeting, and it's obligation to send report about this event to Director for Quality. Director for Quality is Vice Director, and he is on the top of this hierarchy. We also have a Commission for Quality. In this Commission for Quality, we have about 12 people from different clinics, and at these meetings we discuss about adverse events also, and about recommendations and preventive measures in hospital. And after that we write a report and evaluate what has done. For example, our adverse event report have this data in place of adverse event, data about patient, date of adverse event, detailed event description, and measures taken to reduce adverse events, adverse effects of these adverse events, possible cause of the adverse events, and suggested prevent measures. Most of adverse events are false pressure ulcers, but also extravasation of drugs. I can show you what we did about extravasation of chemotherapy drugs and how we reduce risk of cytotoxic drugs through education and guidelines. Nurses reported this incidence connected to cytotoxic drugs, and we organized team for manage this risk in our hospital. After that, we organized courses. We made guidelines, and here you can see two posters from these guidelines. First is workflow after chemotherapy extravasation, and the second one is how healthcare workers has protect themselves after split cytotoxic drugs to the floor, and this is a risk for them health and for patient health. After that, we evaluate this course, and healthcare workers who attended this course feel safer because they well-known procedure what to do, whom to tell these adverse events, how to analyze them, what to do with patient, how to protect themselves. This is one example. After starting of COVID-19 pandemic, our top management of our hospital organized a team for psychological health for employees of University Hospital Center Zagreb. They could ask and speak with this team. In this team, we have their nurse, doctor of medicine, psychiatrist, also psychologist, and they can phone or send a mail and come to counseling every time they want. I speak with them, and they said they have they don't know the exact number, but many people ask them for help and would like to talk about some situation. It's not always adverse events. Sometimes it's fear because of this pandemic. And I think it's a very good start. And I think we could also implement this team and these possibilities for help for healthcare workers after adverse events. This is everything from me today, what I want to share with you. and maybe I can ask you to think about it. Does your institution, how your institution manage adverse events? Do you have written regulations for adverse events? Does your institution provide psychological help for patients and for medical staff? I think it's good to know how it's managed in other countries. And I hope in this project Ernst, many things could be improved, and I hope we will also make guidelines and do some concrete suggestions how to help medical staff after adverse events.
Many thanks, Professor Boiana. It's a great pleasure to have you here. And this was an amazing presentation, very practical for the ones who want to learn from the practice. So a huge thank to that. I don't know, I will let you decide the ones that are seeing this webinar. If you want to answer these questions, please do it on the top chat. So you can find the chat below the YouTube screen. So you have one phrase saying, if you have any question, you could write them here. So please, if you want to share something, do it. I will now move forward to some questions, but if I see something that is being right, so it's, for me, it's totally okay. I'm just following also the YouTube, so please feel free to do it. Okay, so I have some questions, and I will start from the last part, that is from the pandemic, right? We are now still living the pandemic, and we had new structures that started to give some psychological support to the healthcare providers in this moment, difficult moment. This problem that was already happening in other cases when adverse events happen, now it's getting a huge visibility. And I don't know if you can tell us, but regarding this psychological help, the team that you were talking about now in the last part of the presentation, do you know if this structure was only on the first beginning was just for the COVID pandemic, or it will continue? Do you know any information regarding this?
Yes, this will continue. This is not only for COVID answers. COVID pandemic are just hurried up to this. We think about this before, because we recognize that stress at work is a very important task. And this team, before pandemic, also organized yoga session and some groups for employees who need it. Nurses from this team give lectures about stress and how to cope with stress on the individual level. But I think it's very important that we have now team for all employees. And I think this is start to develop something very good for healthcare workers and to mental health of healthcare workers. Because pandemic is something that is really over, and we are under stress all the time, and now we have also pandemic, and this team hurried up with organizing the something concrete. And also we have in Croatia, in Zagreb, 1 year ago big earthquake, and we have a pandemic and earthquake in the same time, and this is really something that people are under acute stress syndrome. Some of them have post-traumatic stress disorders, and I think a team for psychological help is very, very important for all of us.
Yeah, now it's very important to have this feedback, because you had a lot of examples and stressful moments for training your resilience.
Yes.
Yes, so this is something that for you it's much more trained in a practical way, comparing with. But of course, this problem happens in all the healthcare settings. So, and it's very important to understand that an adverse event can really impact the healthcare provider. So, and it's not necessary to have an earthquake, but
Yes.
yeah, but in these cases, when you have really stressful moments, you really have the challenge to improve and to try to give some support to the healthcare providers and all the support teams.
And I would like to say that pandemic and earthquake damage health of healthcare workers, and it's a higher risk for adverse events. If you're under big stress for your life and life of patient, it's a big risk for do something wrong or do error or something.
Okay, and I don't know if you can give us some information about this, but how long are you starting to train this resilience? Much earlier, before all the pandemic and so on, when it started?
About 10 years ago. About 10 years ago, we had first law about quality, and first education about quality start then. And first topic were adverse events. And we also speak about book Paulo managed error is human, because at the beginning employees are very frightened to say that had some adverse events, and they think they will be punished because of this. And at the beginning we have to we effort to explain them that will not happen, that is important to speak about this and find solution how to go through this, how to help patient and how to prevent in the future time. And now I think we have good situation. I didn't put it in this presentation, but I can show also another time how report of adverse events rise, and how more education we can plan according to this report.
Yeah, you know, it's a great motivation to see. It's like, I know that, you know, you have some healthcare settings that are now maybe in the second year of implementation or in the fifth year of the implementation. Now you are already forward 10 years. So, and now you can see, we can see some motivation here in saying, okay, no, we have higher rates of reporting. We now have structures. We have a commission for helping to solve the adverse events. And also you have regulation. That one is the team that we are now discussing. And tell me, you have the law about to protect the patient safety, and what is the impact of having this law? Can you tell us something about it, please?
I think it's very, very good because this law pushed us to go into quality in healthcare, because at the beginning there were no understanding about why this is important, because we did not have informal education, more lecture about quality in healthcare and patient safety. And at the beginning, it's very hard to implement all this. It's this law pushed us, and we have to. This is our obligation. We have obligated quality standards.
Yeah, it's really important to have the regulation. And also you have a commission. You told us about the commission to talk about adverse events. And are you part of this commission or yes?
Yes.
Okay.
President of commission is director for quality. And I'm vice president because I'm from department for quality. And we also have other presidents of other commissions, for example, hospital infection, blood transfusion, transplantation, and other experts, for example, IT experts and other experts from hospital who help to improve all this process.
Yeah, it's great to have this good example, and I don't know if you can give us some input about what is the experience to gather such a big number of professionals, and what is the importance to the importance of having this multidisciplinary team together.
Yes, we are stronger together. If we say something to other employees that Commission for Quality decide something, they are very serious and they will do it. If I said you have to do something, maybe they don't. But if you have a commission, and this is a very strong body for improve quality.
Yes, it's really important, and thank you so much for your input. Now I will ask you something regarding the education and what people can find in Croatia about the training. I know that you talked a little bit in your presentation, but I think now it's important also for the students that are now following this webinar, and also other professionals that want to do some training or want to understand better, and also learn with your knowledge what they can do to have some training.
We don't have so many formal training, but we have continued medical education through the courses, through the conferences or lecture. And these lecture courses and conferences usually organized societies in Croatia. Or a few years ago, we had the Agency for Quality and Accreditation in Healthcare, this agency is now part of Ministry of Health, and they also provided education about quality standards in healthcare. I think it will be very good if it will be in curricula in university program, but we will see.
Yeah, it's another challenges in other countries as well to have patient safety in the curricula. In the different fields of healthcare. So it's really important because this is a multidisciplinary, and as we have been talking, a multidisciplinary problem. So we need all together to solve this.
Yes.
And as you have mentioned, very little has been done for helping the healthcare professionals and workers to cope. So thank you for your practical examples, for your motivation, because now we can see that after 10 years and even less, of course, we can have a law, we can have regulation, we can have commissions, and we can work as a multidisciplinary team. So I don't know if you want to add other question, or I have one question. So I was finishing, but now I have one. So is the patient representative also part of the commission?
In our hospital, no. In this commission for quality, there are medical experts who work in surgery, anesthesiology, transplantation, blood transfusion, nursing, and we are internal body, and we speak about problems in our hospital and how to manage this, and about programs for improving healthcare.
Okay.
I think it's very important to hear patient voice, and we also a few years ago start to work with NGOs of patients, and we did some courses together with patients organization. But I think it is at the beginning. But we think it's a very good idea to involve patients in the decisions and to do together.
Yeah, the importance of having a patient-centered care.
Yes.
So we know that, and it's really important to involve them and having a representative in the associations and the societies and commissions. Okay, I don't know if you want to add something more. I don't have any more questions. Really, thank you for your question, Veronica, that is following us on YouTube. And I will let you the last words if you want to add something.
I would like to thank you very much to invite me here, and I'm very glad to be with you. It will be part of Ernst project, and I hope we will do something good and to improve patient safety and healthcare safety.
Thank you so much. Thank you so much for your participation, your work, and help also, because you have helped me a lot during these last months, also with the training school, to give me some feedback. I really appreciate your support. And yeah, so we will finish. It was a great pleasure to have you here, a great conversation, a great webinar. So Many thanks for that. And tomorrow we will have other webinars, 2 webinars. We will start at 10 from the Central European Time. And I will see you tomorrow. Please, if you have any question, you can follow us on and also send some email to info@ernst.eu. And I will see you tomorrow. Bye-bye. Thank you. Thank you so much to everybody.
Thank you, everybody. Thank you, Sophie.